Let's invite the deputations and individuals attending the public hearing to come into the conference room. Please also invite the public officers. I just want to remind members that this is a special meeting. We are actually holding a public hearing, and we'll talk about the strategic review on healthcare manpower planning and professional development. I would like to welcome the public officers. They're taking their seat, and then for the participants of the public hearing, they are coming in. We'll give the floor to them, and for the first session, we will have it until 4 p.m. and then we have a break, and then the second session will last until 5:30. So I'll just wait for everyone to settle down first, and then for the first 13 individuals or deputations, give them time to move into the conference room.
唔係幾好，規矩嚟㗎，大佬，有規有矩，你識我件事。好，歡迎有關團體嘅人士咧，就係嚟到我哋呢個
I would like to welcome everyone. We are here to hold a public hearing, so please take your seat according to the sitting plan. Some deputations are not able to join us today owing to one reason or other. Their written submissions have been circulated to the government as well as members. I think almost everybody has taken your seat. I understand that the rain is heavy outside, so some of the deputations may be on the way, so I will make a start while we wait for them. And for the current session, we'll have it until 4 p.m. We have about a dozen of deputations or individuals wishing to speak. Now, I'll give you 3 minutes each, and I just I want to remind you that what you say will not be covered by the protection and immunity provided under the Legislative Council Privileges Ordinance. In other words, you have to be responsible for your address. You have 3 minutes, so I will give the floor to the deputations or individuals, and then admin and members will speak, and then we'll have a break. So first of all, Mrs. Chen, you have 3 minutes. Thank you. Thank you, Chair. I represent the Hong Kong Physiotherapists Union. Well, the steering committee did not ask the administration to establish the healthcare manpower ratio. This is disappointing. This is because for the Hong Kong U to reject the healthcare manpower ratio as a basis to establish the generic model, we have grave reservation. The society is aging. There is growing aspiration about our healthcare service on the part of the citizens. If the administration adopts the established healthcare manpower ratio as the basis for manpower projection, then we can certainly strike a balance between quality and quantity. For a people-based or people-oriented government, it should make good use of the established manpower ratio so as to balance the supply as well as the demand of the citizens. By having the established healthcare manpower ratio as the basis for manpower projection, it can become the target for the training of professionals. And we are going to elaborate on this point later on. In this way, we can avoid consistent shortage or oversupply of manpower. And fourthly, any manpower planning must include the established healthcare manpower ratio. Otherwise, we cannot have a sustainable healthcare system. To conclude my speech, I'm sure Mr. Chris Sun and Mr. Fong are well familiar with our arguments. On different occasions, we have already talked about the healthcare manpower ratio. The profession would like to ask the administration to do the following. When updating the manpower projection, please move with the times and please adopt the manpower ratio as the basis for manpower projection or manpower planning. In this way, we can effectively quantify the demand for manpower, and we can also narrow the gap between demand and supply, and we can sustain the efforts to enhance the effectiveness of our healthcare system. Currently, for the subvented homes, for a good home, you have a couple of physiotherapists. Others may have one or two. Even for Class 1 board-placed hostels, just 0.5 or 1 physiotherapist. For private homes, they may not even have physiotherapists. So please consider our plea. Second, the Hong Kong Physiotherapy Association. The association also welcomed the administration's work on manpower planning and professional development. We hope that in the coming cycle, you can tie in with the UGC cycle so as to avoid what we encountered in the past. That is, sometimes we had trained up a lot of people and yet they didn't have jobs. We understand that in the coming 3 years, the government is going to repeat the exercise. There will be a review on the healthcare manpower planning. We hope that the administration will incorporate the following factors. First of all, we hope that the administration will set up a manpower ratio. This is because we have found that the report is still based on the existing service model as well as the waiting time. I think they seriously undermined the demand for physiotherapy as well as the need for more manpower. Currently, you need to wait for 20-30 weeks before you get your service. This is unsatisfactory. And let's look at the international data. In Hong Kong, each physiotherapist has to take care of 2,500 citizens. In the UK, I think we have a similar healthcare system. In the UK, each physiotherapist only takes care of 1,344 citizens. So we hope that in the future, we can have a ratio so that by having this ratio, we can maintain the quality of our health care. And then we have got a shortage of physiotherapists among the welfare institutions. This is because they haven't got supervision from a supervisor, and we haven't got sufficient supervisory training, and we haven't got a clear promotional ladder, and therefore for new graduates, they can only stay with a welfare organization for a short period of time, say 2 or 3 years, and they have to leave. In other words, it is difficult to retain manpower. In the report, it has been mentioned that perhaps we should rely on self-financed courses for physiotherapists so as to ease the manpower shortage. Yes, indeed, it has helped, but we're not able to retain the manpower due to the reasons that I've outlined. So I hope the administration will enhance the following effort, that is provide more subsidized places. We can't count on the self-financing sector for the training. As to the accreditation, again, it lacks transparency. I hope that the committee will do more in this regard. There should be a higher degree of transparency so that there will be better training. Thank you. Thank you, Mr. Chairman. For this report, it is about aging of our population. So it will mean that we have a serious shortage of manpower in relation to physiotherapists. 2 points are lacking. First of all, manpower ratio. Second, the model. Currently, the projection is based on the hospital setting. What about community care?
But this has only been a slogan. Now, the males live up to 81, the females live up to 87. Many elderly patients tell me that I don't want to live so long. I'm afraid of suffering from pain and illnesses, and I can't die and I cannot live properly. Now, this is a common complaint. Now, arthritis, Parkinson's diseases, they cause the elderly to lose the power of mobility, and gradually they cannot take care of themselves. And they cannot live in hospitals for the rest of their lives. And it's like the case in Yutong Estate. An elderly spouse took care of the elderly person, and eventually he was stabbed to death. Now, there are 30,000 elderly persons on the waiting list. They await for a community-based health care so that they can take care of themselves living in their homes. Now, however, there is no reasonable projection for such demand. We think that this is a serious underestimation of the manpower needed. And there is no established manpower ratio. Now, in hospitals, the waiting time is 8 to 9 weeks. The HA tells the physiotherapist to take care of more cases. In Singapore, it's about 18 cases per day. In Hong Kong, about 40. In some cases, it's even 60 per day. Now the therapist has to go to a toilet. He only has 10 minutes for each patient, sometimes only 7 minutes. That includes new cases. And you cannot adopt this kind of exceptional procedure. Now, the First Lady went to visit an elderly homes. Now, the elderly person showed some exceptional feats. Now, but however, not many are able to live in such homes. I'm Chang Chak-man. Now, we must be fair in sharing of resources. Now, we want to resist red health care. Now, the government says there is a shortage of manpower of 2,200. And I'm against importing healthcare personnel from the mainland, because the Chinese Communist healthcare is sometimes not reliable in what they report. In April, there was an institution, Springer, and there were 107 academic public published essays were retracted, and most of them have to do with authors in the mainland. And there are other cases internationally. Now, if we want to import Western-trained medical practitioners, we should import them from the British Commonwealth. And given the shortage of manpower in Hong Kong, there should be fairer distribution of resources. We should also invest in Chinese medical practitioners and also in natural therapy, not just Western medicine. There should be independent Chinese medicine hospitals. Mr. Li Yuming, a famous Chinese medical practitioner, says that the Western and Chinese medicines deal with different aspects of people's health. Now, the Chinese medicine tends towards natural therapy, natural healing, and there is shown effectiveness of healing in a natural in accordance with the natural development, according to a study by Gibson in 1980. Now, patients of arthritis were able to improve in their situation. Now, in 1994, another study of children suffering from dysentery in Nicaragua, they were also able to recover with the help of alternative medicine. So these are better alternatives. Thank you, Mr. Zhang. Now, in my recollection, the Health Services Panel, the steering committee did not propose to import mainland medical personnel. Now, I have certain views on the review. Now, on the improvement of the structure of the physiotherapist committee. Now, right now the membership is all appointed by the government, and the members are all doctors, and the course curriculum is not sufficient with regard to professional development, and the transparency is very low, and the courses of quality are affected. And also physiotherapists, they are supposed to as physiotherapist is to be a chairperson of the physiotherapist management committee. We agree with that. There should be increased participation by patients as well, and we should also continue to improve on education and professional development. Now, the shortage of manpower in Hong Kong is very serious, and compared to the UK, it's worse. And it's been mentioned by other speakers that in UK, each physiotherapist takes care of about now in Hong Kong, one physiotherapist takes care of 2,300 plus patients, and the office, the service provided is reduced accordingly. Now, the ratio should be drawn up again. Now, it's said that 365 days of physiotherapy service is provided, and yet you should know that when an elderly person enters a hospital and when there is inadequate manpower, how can you offer 365 days of service a year? Now, I think there should be clearer guidelines and commitments in this regard. Next, Mr. Young. We thank the members and the officials for being here. Now, I think it's a very difficult issue to resolve, to improve the manpower situation by 2030, and yet it is unprecedented. It's a very major program. It's a good start. The Institute of Psychiatric Healthcare in Hong Kong is a bit disappointed in this report. Now, even though it's difficult to make a projection, yet we need a holistic and long-term plan to support the forecasted manpower need. Now, there has always been a shortage of psychiatric nurses. The report seems to say that there's a surplus, however. Now, the practitioners hope that there can be new graduates to fill up the vacancies, and yet the report says there's a surplus, and many colleagues are shocked and disappointed. Now, the report is a good one. It does encourage the HA and the Social Welfare Department to hire more manpower, but this is only piecemeal and remedial, and the public and the SCL government actually is not really aware of the role played by psychiatric nurses. Now, the basis of estimation is a bit outdated, so we want to express our strong dissatisfaction. Now, it's based on the services in the past, which is very much confined, and yet if we use the same model for 2030, this would be a very backward mode of projection. Now, as the population and society change, there are many problems of mental health. Now, for the the wards are right now contain too many different kinds of patients. Dr. Wong, I am a representative of the Open University. Now it's forecast that in 10 to 15 next 10 to 15 years there will be a surplus of psychiatric nurses. Actually, there has been a lot of change. Now, it used to be hospital-oriented, and now it's tends to be focused on community care. Now, a frontline nurse has to take care of 50 to 60 patients. In the U.S., the ratio is 1 to 20, so it's lagging far behind developed countries. Plus, population is ages. The psychiatric care of the elderly is rising in need, and there has been suicides by students, and that shows a need for service. And the waiting time is 2 years, and so the forecast of surplus manpower is unreasonable, and the volume of work is not taken into account. The psychiatric nurse to spend a lot of time on behavior therapy and psychological support and so on. And the psychiatric service grows as people have a greater understanding of psychiatric needs. It takes 5 years to train a psychiatric healthcare professional, and we must rely on sustained enhancement of local training. As for general nurses, the review expects that there will be a shortage of manpower. We think that the shortage is understated. Now, the ratio is 1 to 12, and nighttime it's 1 to 20, but internationally the nurse-to-patient ratio is 1 to 6. Now, the model uses the current situation as the basis for future projection. That's inadequate. And also the private market, the market also lures more personnel away from the public sector, and healthcare needs will continue to grow steadily. So stepping up local training is the way ahead.
Next, Madam Chiu Yun Yi. I'm a registered physiotherapist. In relation to this particular report, I've got the following 2 recommendations to make. Just now, our colleagues have made a similar point. I just want to add to what they have said. First of all, we must set up a manpower ratio for physiotherapists. This is because the report is based on the existing service model as well as the waiting time. For such a manpower projection model, it is most unsatisfactory. I think you know that for rehab service, it takes a long time to get to your turn to get physiotherapy. This is unsatisfactory. In future, I don't think we have got sufficient manpower to deal with an aging population and meet the service demand. When we don't even have sufficient service, then how can we maintain the quality of our service? The report is also silent on community care as well as primary care in relation to our service. So I think we have to do more in order to deal with an aging population and also aging in community. Don't forget that for our young people, our children, our school children, they are the future of our society. Currently, we have got preschool children who have special educational needs. There are also children who have special needs for rehabilitation. Currently, it takes a long time for them to wait for the service, or even a long waiting time to get assessment. Therefore, in 2011, the Community Care Fund has come up with a special scheme for preschool children so that they can get a rehab service. And this scheme was well received, and in 2014 this was regularized, and the SWD has invited subvented organizations that are eligible to provide a training subsidy to eligible children who have such a need. It is a good idea, but then for the physiotherapists to be needed, it has not been factored into the projection in the report. So despite the scheme, which is a good one, I'm afraid we cannot recruit enough physiotherapists to launch the scheme. Moreover, for welfare organizations like preschool training facilities or childcare centers, since we haven't got a patient load ratio and we haven't got supervisors ratios to supervise the frontline PTs, it is difficult. Liberal Party, I'm really angry because the pandemics vetoed the medical registration amendment bill by filibustering. Now you talk about justice. How can you do justice to patients who have died? What about the backlog of thousands of them? For the laypersons, the number will be increased. We hope that there can be transparency in the medical council. It is necessary. Otherwise, medical doctors will just protect themselves. Like in 1999 at QMH, there was this doctor, Dong Hiu-ming, and he was making a phone call while he was carrying out an operation and not about any medical issues. But then the finding was that he had not committed any professional misconduct. And then for the case concerning Mr. Zheng and Mrs. Zheng, it dragged on for 9 years. It was excruciating. How come that the pandemics were against the amendment bill? Now, it is said that many mainlanders have come to Hong Kong. They have poor skills and they have come here to take the licentiating examination. You are biased. You are discriminatory. Everybody has to sit the exam, even mainlanders. Do you think that we are going to make it easy for them? The passing rate has been low. Before the return of Hong Kong to China, Commonwealth doctors did not have to take an exam before they can practice in Hong Kong. I have full respect for doctors, but please do not give up the public interest just for your own sake. Now, even for the removal of bile, I think it takes a long time to get to your turn. It is very expensive to visit a private doctor. So I suggest that we need to introduce more overseas doctors to come to Hong Kong so that public and private hospitals will have more competition. This can help the citizens. I think you know that we don't have sufficient doctors. We have only got 1.9 doctors for 1,000. It should be 2.3, 2.4. The population in Hong Kong is aging. We need a lot of doctors. And then for training, I hope that the government will train more doctors and give more training to other healthcare professions. I think we're lagging behind many European and American countries in many aspects. So I hope the admin and the pandemics will pass an amendment bill so that we fight for justice instead of the sectoral interests of the professions. Thank you. Next, Ms. Zhang Chek-yi. I also speak on behalf of the Liberal Party. We believe that we should relaunch the medical registration amendment bill. I think for the bill, we should enhance it so that there will be more lay persons. Instead of 4, there should be 8, so as to enhance the credibility and transparency of the Hong Kong Medical Council. We should also allow the doctors with limited registration to stay longer so as to ease the manpower shortage. We have got over 900 cases in the backlog, and there will be an increase of 500 a year for the Medical Council. It takes 58 months to wait for the case to be heard. This is unfair to the patients' relatives. It is excruciating. It is unbearable. The government must amend the law as soon as possible. We should reform the complaint and investigation mechanisms of the Hong Kong MC. We should expedite the pace. Hong Kong is aging. We have a growing demand for healthcare service, and yet the doctor shortage is getting worse. There is an imbalance between demand and supply, and private doctors are very expensive, and we need to increase the public sector. Currently, the waiting time is getting longer and longer. For you to visit the private sector, you will be sort of freezed. You have to pay a lot of money. So I think we need to consider relaxing the rules so that overseas doctors can come to Hong Kong to practice. And for the report, I think it lacks vision. The recommendations are very crude. It isn't just it hasn't talked about the lowering of the standards as a result of lack of manpower. I think it is a very rushed report. The recommendations are not specific. Our doctor ratio is lagging behind. It's 3.3, 2.3 for Japan. And for Singapore, it is 3. But Hong Kong, we have only got 1.9 doctors per 1,000. The Liberal Party is of the view that for every 1,000 citizens, we should have 2.3 doctors. But then the administration hasn't got a clear target. The government is not going to come up with a clear manpower ratio. We need to increase the manpower. It is just basic fundamental knowledge. The doctors shouldn't practice protectionism. I think we should get more overseas doctors. The local doctors are against the introduction of overseas doctors, saying that their standards vary. I think we need to reform the mechanism. It is not something that we can afford to delay, and I hope that you will endorse the bill as soon as possible. Next, Mr. Chen Kin-yip. Have you ever visited a public hospital at night and want to get the A&E service? I have. Unless I was very uncomfortable, I would wait till the following day to visit private doctor. I was half alive, half dead, and I waited for 6 hours. I wasn't the only one suffering there. I think it's worse if you are sick than when you are poor. When you are sick, it is already very bad, and you stay in the A&E room you will be watching the display panel all the time. I'm relatively young, and you can imagine how bad it is for an elderly person. It isn't just a matter of coming up with a few funds and schemes or handing out money, and then you can solve the problem. We have got 14,000 doctors. In 2016, we lacked 250. In 2020, we lacked 500. By 2030, for 6 professions, we have shortage, including doctors, dentists, and nurses. We will be short of 1,000 doctors. We will be short of nurses by 1,600. Just now, many speakers have said that even for Japan, which is aging badly, they have got 2.3 doctors per 1,000 citizens. We've only got 1.9, so we are lagging behind gravely. And our aging population is getting worse. So what are we going to do? The government must be clear about the need to set up a manpower ratio. Initially, it should be raised to 2.3. Well, with the population aging, we have a growing demand for doctors. The waiting time is too long. The service is inadequate. I think it is just common sense to know that we have to increase manpower. We mustn't allow protectionism to reject the call for more overseas doctors to come to Hong Kong. Prior to the return of Hong Kong to China, Commonwealth doctors didn't have to take an exam to come here. In Singapore, Australia, Canada, they encountered a problem of doctor shortage many years ago, and they took early action to get overseas doctors. They didn't have to take an exam. They were given local training. Say, for example, in Singapore, 2/3 of their newly registered doctors have come from overseas. By admitting them doesn't necessarily mean that we are compromising on quality, but without adequate doctors, the quality will certainly be compromised. There are more and more medical incidents. It shows that it is already an alarm for us to take heed of. We must address the problem of manpower shortage. We should also give priority to Hong Kongers who graduated from overseas medical schools to come back to Hong Kong. And we should also allow the limited registration to have a validity of 3 years instead of 1. Ms. Xun, I'm a physiotherapist. I represent the Physio Action. Now, for the UGC, there will be 130 places instead of 60 places, which are subvented by the UGC. It is misleading. In fact, we already got 130 places a few years back. But then the government lacked long-term planning. And as a result of economic problems, there was a suspension of recruitment of PTs. Many graduates lost their jobs. And eventually, the number of places went down to 60, and we have to live with the negative effects. All the time, the Polytechnic U has been training PTs. We have got 130 places. For doctors and nurses, well, they have got more than one subvented UGC institution providing training. For doctors, by 2030, the manpower shortage will be 10%. Currently, Hong Kong U, CU Hong Kong are training doctors. Altogether, 470. All of them are fully subvented by the Hong Kong government. For nurses in 2030, the shortage is 3.3. Hong Kong U, CU Hong Kong, Polytechnic U are training nurses, a total of 750 places. For PTs, by 2030, the shortage will be 21.6%, and it is a very serious case. When compared with doctors and nurses, our case is more serious, but we have only got 130 subvented places. How come that they are recommending the provision of self-finance programs instead of subvented programs? This is most unfair.
And the government has ignored the training of physiotherapists. Now, we think that there is a shortage of physiotherapists. The government should provide funding for regular physiotherapy courses, and there should be practical training, for instance, at places such as Chinese U and Hong Kong U. There should be more places like those. And in the vetting of curriculum, we don't know the requirements of the vetting, and we don't know why it's kept so confidential. We are concerned whether the training provided will be adequate. Now, we request that the curriculum requirements are open to the public, and the new curricula should be approved by the relevant authorities first, so that the persons trained are able to get jobs. The Nursing Association has always been concerned about the manpower situation. We think right now the emphasis is on quantity rather than quality, and it looks more backward than future-looking. Now, Dr. Wong already mentioned that in the public hospitals, the nurse-to-patients ratio is far lower than the 1 to 4.6 internationally. That has to be improved. And in the community, we strongly request the authorities to increase the number of psychiatric nurses, and each manager should take care of 20 to 30 patients. And right now, the homes for the elderly and homes for the handicapped, there should be more professionally trained nurses. There should be better regulation to ensure that the inmates are well taken care of. And clinical development is very important, and the professionalization of the healthcare profession is very much necessary. This would lower medical costs, reduce the hospitalization time, and nurses of different specializations can offer better services to their patients as a result. The should be registration systems for the specialized nurses. Each specialization should determine the curriculum and be accredited by the suitable authorities, and the public should also be able to learn about it in an open manner. Now, the clinical nursing developments quality should be improved. Next, Tam Sao Lan. Now, there is a shortage of healthcare personnel. Now, at the healthcare centers, the elderly persons should be given annual teeth examinations because they suffer from tooth decay. They cannot afford to see doctors, and the government doesn't provide dental care. So the teeth are lost one by one. The annual health checks should cover the teeth as well. And there should also be dental care. So the healthcare centers should provide that service. Mr. Lin Wai Kiu of SOCO. Now, the therapists and the nurses told us that the projection is based on the current benchmark, and so this seems to tell us that there's a shortage of doctors. So they did the calculations for 5 years, but this is obvious. Now, the waiting time for specialist doctors' care is a few years long. Now, dental care is very much deficient, and if you tell us there's a shortage of doctors and dentists, that's just obvious. Now, for instance, in care for the elderly, now the waiting time for specialized care should be reduced to under 1 year. And the healthcare centers for the elderly right now only serve 3.8% of the elderly. Now, they should serve all those under the poverty line, and then the manpower needs should be calculated on that basis. Now, how many dentists are necessary to provide dental care for the grassroots? That should be the basis for the projection. Right now, it seems that from the report that the shortage is only 50-odd dentists, and it's said that there's a surplus in psychiatric nurses, but that's not consistent with common observations. Now, I think we should raise the standard of the care when making projections. Many grassroots patients and the elderly, they suffer every day. They may fall ill during during the waiting period. Now, one needs a doctor when one is sick, and I'm afraid of going to accident and emergency department. I don't know how long I have to wait. I am registered, then the body temperature is measured, and the nurse asks you a couple of questions, and then you have to wait for a few hours before your name is called. Now, and when I ask when will be my turn, the nurse tells me the doctor is very busy. Many patients with more severe illnesses than you are still waiting. Now, can you give me a pain-killing pill? The nurse says, we don't have the prescription from the doctor. It's not just the A&E. Now, in the general clinic, and people are queuing up longer and longer. There is an even greater shortage of physiotherapists. Now, for the second appointment, one has to wait over 2 months. So one's health cannot improve. So the government should engage more doctors and reduce the manpower shortage to reduce the pain of the patients during the waiting period. Hong Kong has a large population. Many are from the grassroots. They can't afford to go to private hospitals, so they depend on the public hospitals. The manpower shortage severely affects their health. The government should introduce short-term measures to resolve the immediate need. the government should also hire more dentists, because as we grow old, and dental care is so expensive, so the teeth keep falling off. So even though the community care fund provides for false teeth, yet it doesn't help that much. I represent the Association of Practicing Optometrists. We agree that there is a shortage of manpower in the medium and long term for optometrists. This is the case at the company where I work. 90% of the optometrists are in private practice, in optical centers and in eyeglass shops and so on. Now, the retail sector is very often affected by the economy, and the healthcare vouchers also introduce greater demand. Now there are over 2,000 optometrists. Now over 1,000 of them are under temporary registration, under Part 4 so-called Part 4 registration, and they entered the field in about 1996, and they are now approaching retirement. And the government says that there's a 50% shortage, that there are 500, there's a shortage of 500 by 2030. We don't quite agree with that. Now, they did their calculation based on the retirement age for the government employees, yet optometrists can work till 70 or even older. Now, so that is not an accurate projection. Now, also the workload for optometrists is not as heavy as for other healthcare professions. Now, very often you can walk in and get the service of an optometrist. The workload is not that heavy. Now, we know that there's a shortage in the medium and long term. The Polytechnic University provides about 40 graduates every year. We hope that in the curriculum there should be more students, maybe gradual increase to 50 or 60. Then we think that would provide sufficient manpower. Now, the report says that there's a large shortage, and it says that there should be more self-financing programs, but we think that these should be within the Polytechnic University. Now, our party supports the report. This should provide good reference. We have several comments. Now, many members of the public think that there's an increasing demand for health care, especially as the population ages. There's a greater shortage in the public sector. Work hours are long. The pressure is high, so more personnel move into the private sector. Now, we try to retain more healthcare workers within the public healthcare system. The government can also make better use of the manpower resources in the private sector. Now, the private sector participation scheme should be expanded from the current 3 districts. This public-private partnership program should be extended to reduce the pressure on the public sector, and the administrative procedure should be streamlined for high efficiency. Now, right now, faxes are used. Now, healthcare workers tell me that they resist the use of faxes, and so we think there should be streamlining of IT procedures so that there can be better communications between the public and private sector, and also there should be more tax incentive for healthcare insurance.
We favor the introduction of overseas healthcare professionals. We can introduce a limited scheme to import non-locally trained doctors. And then for the medical registration amendment bill, 2016, there was a suggestion to have a limited registration for 3 years. This is good. We need to maintain the quality of professional healthcare service. I think we can appropriately relax the entry threshold. In Singapore, Singapore has already signed agreements with certain overseas institutions so that the graduates can go to Singapore to practice without sitting an examination. All right, thank you. 18 deputations or individuals have come here to speak on the healthcare manpower planning report. We have about 30 minutes left for the first session. The floor is now open to the admin as well as members. A number of members, 4 of you, would like to ask questions. Now, for deputations and individuals, in the first session, they will leave upon the end of the session. So please take the opportunity to direct any questions for them at this moment. Ms. Alice Mack. For the review, the finding is that in many professions we will suffer from a manpower shortage. This is worrying. In the light of the likely shortages in different fields, what is the government going to do? And then for participants who spoke, first of all, let me say thank you to you for coming. Well, in the review report, a lot of information has been given. Some of the professions have said that the government's report has failed to reflect the true picture. Sometimes the administration may say that there is shortage in a particular profession, but the profession is saying that it is more serious than depicted by the government. Or where the government says there's no shortage, they're saying that there is a shortage. Now, today we have also got a number of senior citizens here. They have talked about their expectations about the public healthcare sector. They hope that there will be sufficient healthcare manpower and we can provide appropriate service to them, and they don't have to wait for such a long time. Now, we know what the picture is like, but without telling us what the solution is to be introduced, then it would only cause panic among us. Yes, Mr. Sun, or well, let me talk about the broader strategic issues, and then I will focus on the points made by Ms. Mack. Now, today, many of you have referred to the assumptions as well as important data in the report prepared by the Hong Kong U. I want to take this opportunity to explain. For the model of the Hong Kong U, as many of you have said, it is not easy at all. Hong Kong U has made reference to overseas models. The approach has varied from one place to another. It is not easy at all, but then by having such a model, it is good for 2 points. First of all, it is a good tool to tell us about the future demand and the future supply. And as a result of working on the development of such a model, there was a need to communicate, there was a need to interact, because for each and every profession, before we came up with the finding, we had to carry out a lot of research work. Well, I think you all know that the Hong Kong U won't pluck the figures from thin air. The Hong Kong U has to be as realistic as possible. And then we have adopted 2015 as the benchmark. That's the broad benchmark. But then for factors already known, then they will also be included in the model. Say, for example, mental health or community care. And then we know that we have the preschool rehab service and the relevant manpower demand. Such has been factored in as well. We have a close dialogue with the SWD. Their planned services have been known to us. As to the shortage of PTs, well, this is because of a good communication with the SWD. They have tried their best to tell us what they know or what they plan. So anything that is already known has been factored in. But for others, if there is still some uncertainty, then such a factor will not be included in the model. But we believe that by establishing such a model and by having such a projection model, it will facilitate our discussion. Say, for example, the current finding is such that there is a manpower shortage, then we'll work hard to resume the balance. I don't think we should ever use the word oversupply. When we see that there is sufficient manpower, then it provides a good opportunity for us. It means that the supply is adequate, and it means that there's room for us to talk about quantity, quality, or the approach of service delivery. I think this is a point clearly spelled out in the report. When we talk about a sufficient supply of manpower, it means that there's room for development. We won't use the word oversupply. If the quality has changed or the scope has changed, then it means that the next time we run the model, the finding will be different. Going back to Ms. Mack's question, well, we need to work on a number of fronts according to the model's projection. And if we see that there's going to be a shortage, then first of all, we'll look at the UGC. We'll try to see whether there's room for expansion. Other than counting on the UGC subvention, we'll also try to see if self-financing programs can also deliver. As mentioned in the report, nursing is a good example. In the past, we had a very serious problem of nurse shortage. We're able to achieve a big improvement. This is because, according to the report, we have done a lot of work in terms of self-financing programs. We have got 2,200 nurses being trained by different training bodies. But of course, we need to be clear about the overriding principle. We would never compromise on the professional quality, and it will be up to the professional bodies to be the gatekeeper. We have already said that we have to make sure that the quality will not be compromised. Whether we rely on UGC subvention or self-financing, we'll make sure that the quality will be maintained. When it is expected that there will be a manpower shortage, first of all, we'll focus on the shortage in the public sector. I think you will understand that within the public sector, there is the retirement age, and we'll try to see if we can retain those who are going to retire, say keep them for a few more years, and then we can address or ease the problem of manpower shortage. And Without affecting the quality of our service, we'll try to see if we can facilitate non-locally trained professionals to come to Hong Kong to practice. But of course, the overriding principle is that the quality should not be worse than what we have got. When we can be assured of that, then the next step is to facilitate their return. There are a few ways to go about it, whether exam can be taken a few times, whether we can provide more information, or by making it attractive for them to come back to Hong Kong. And then for this sort of manpower projection work, it can never be 100% accurate. This is the first time that we did it. It is not easy to come by, and we're going to do it once every 3 years. But it doesn't mean that we're merely updating the figures. I think the process itself is also important. The attendees today are known to us. We have been engaged in very detailed discussion. For the next round of our work, we'll be extending an invitation to the deputations here to see if we can seek further improvement on the existing basis. Dr. Fernando Zhang. Thank you, Chair. I would like to express my gratitude to the deputations and individuals who came. The basis of the projection is built on the existing service delivery model. What about homes for the elderly? What about homes for the disabled? Private homes account for 70% of our places. They don't need OTs, PETs, etc. They only need to have healthcare attendants or healthcare workers. Now we've got the aging population. We want people to age at home, and we need a large number of professionals. And you haven't considered that at all. It is a serious underestimation. I think we have manpower shortage across the board, perhaps with the exception of the optometrists. Probably it isn't as tight as the case in other professions. Now it is said that you're going to use 4 ways to retain the manpower. I think we should train the professionals in the public sector for self-financing programs. Not that I would say that it doesn't work, but then it is not going to be cheap. It costs $110,000 a year, vis-a-vis $40,000 in the subvented programs. So does it mean that only those who have the financial means can enroll in training programs that we have a very strong demand for the professionals involved? And then for the institutions involved, it is unfair to expect them to come up with self-financing programs. They need to raise a lot of money to start the course, and then they have to charge a very expensive tuition fee before they can put together such a program. Moreover, even if we continue with the existing training model, there will still be a severe manpower shortage. So I don't think you have presented a report that can solve the problems. You're simply trying to water down the seriousness of the problem. But still, it is good for you to publish the report. At least you are willing to face up to the problem. So I need to commend you for that. However, you have scaled down the problem, and you haven't come up with a solution. Now, we have got a new term of government. It is said that there will be a new mindset, there will be a new style of governance. So I just wonder if you will take a look of the report and for the manpower shortages that you have already identified, to what extent can you address the problem using the 4 initiatives that you proposed? If not, please also look at the aging of the population. Please look at the actual extent of shortage, and please tell us what additional measures will be resorted to solve the problem. Perhaps it will take an interdepartmental mechanism to follow up on the manpower shortage in the healthcare sector. Mr. Sun. Thank you, Chair. Thank you, Dr. Zhang. For this manpower projection, for both the model as well as the process, we believe that it has presented a very good opportunity for us to put together things that we have observed in different policy areas, and we try to project the extent of the shortage. We believe that whether it is welfare planning or healthcare planning, whenever manpower is involved, I think after all it boils down to three things. First of all, resources, whether we've got the money. Second, whether you have got the venues. And thirdly, whether you have got the adequate number of professionals. Money, that's something we need to talk about. Venues, we need to prepare for that. And for manpower, again, it is something important. Therefore, we believe that the importance of the report is that it has given us a very important tool so that we know about the interaction among the three factors.
So
we think that this is an interactive process. Now, when we are aware of the manpower supply situation, then this provides useful data, and we will know whether the problems can be tackled adequately and how the shortage can be resolved. For most of the healthcare professions, we rely on the training provided under the UGC-funded institutions. Now, if some goals can be achieved by self-financing programs and quality is not compromised, shouldn't we embark on those? And for instance, take radiologists. Now, the subsidy is $70,000 per year. Now, after proper accreditation and after the subsidy, the financial burden of the students are much reduced. And this is our current approach is that there would be 15,000 places for first-year university students. And we need to strike a balance among all the professions. And in the past 10 years, we have kept increasing the number of places in healthcare training. But we must also look at self-financing programs. There are quite a number of local students who chose to study abroad, and if they do so, and if they become educated in healthcare, we should try to attract them to come back to Hong Kong. So we must adopt a multi-pronged approach to gradually resolve the manpower shortage. We thank the deputations for coming. The need for healthcare in Hong Kong has been discussed very often in this panel, and long waiting times, etc., have always been problems. Take nurses, for instance. Now, the ratio is far below the international norm of 1 to 4, and the report is over 100 pages long. The administration says that in the future it will conduct a review every 3 years, and it's said that training is very important for the manpower situation, and there are over 10 recommendations. I do not know how they are arrived at. And the program suggested will be from 3 to 10 years, and given the shortage in manpower, are there immediate steps that the government can take among the different bureaus and departments? And for instance, in the local education and training. So can you tell us about the overall arrangement for the manpower training? Now, if we rely on local training, whether it's the UGC funded or the self-financed institutions, this is part of the medium and long-term approach. We try to attract also non-locally trained healthcare professionals to come to Hong Kong. For different professions, there are different avenues for the healthcare professionals to come back to Hong Kong. Now we can provide more information, and we also talk to the regulatory bodies. Perhaps there can be more frequent examinations. The information can be provided in a more transparent manner. Now, for some professions, there doesn't have to be local examination. There can be recognition of training abroad. And we also talk to the social welfare organizations regarding the physiotherapists and occupational therapists. We talk to them, those students in the UK. We tell them how they can apply to come back to work in Hong Kong. We tell them that there's a great demand in Hong Kong, so we adopt both short, medium, and long-term measures, and so we have to provide our comments for the UGC's guidance. Now you have many recommendations. Now you would like us to focus on several of them. There are 5 recommendations on manpower supply and 5 other recommendations on professional development. That's on lay membership, the mechanism for investigations on complaints, continued professional development, registration program, cost recovery, and so on. And there are regulatory bodies to whom we will write to them regarding the implementation of these steps. There are 5 minutes left. For this segment, we have talked about the major directions. Now, 2 of the speakers mentioned the shortage in dental service and the deficiency in number of dentists. Now, and yet the review says that there is not a large shortage of dentists. Now, can you tell us more in this regard? Now, for the elderly, it can be anticipated that dental care is more important. We have started an outreach program which has been quite popular. I took part in that too. The Community Care Fund also provided subsidy for that, and we also provided dental care for the mentally handicapped, so all this has been taken into account in our review. The government has been working on this in the past few years. We mainly target the elderly and disadvantaged groups. So we have come to almost the end of this segment, and we understand your viewpoint. We will now have a break of 10 minutes, and at 4:05 we will have the next segment. Thank you for coming.